This conference will now be recorded.
Good afternoon, everyone, and welcome to the fourth Friday webinar series, Faces and Voices of Recovery. We're pleased to welcome you to Utilizing Peer Support in Probation Programs, Innovative Ways to Reduce Recidivism and Improve Recovery Outcomes. We will be continuing to have a webinar on the fourth Friday of each month as part of our mission at Faces and Voices of Recovery is to educate the public and providers and peer recovery support services organizations on innovative and best practices on peer recovery support. So this series focuses on programs and advocacy, ways that you can advocate for improving peer support for the people that you serve in your programs across the nation. So thank you for joining us today. I'd like to let you all know that your phones are on mute. You will not be able to ask questions during the event today, the workshop or the webinar today. However, feel free to be typing questions in or comments into the chat box on your screen. So now I'd like to introduce our presenter today, Susan Broderick. Susan is the founder and CEO of Building Bridges to Recovery. She has served as an assistant research professor at Georgetown University and was the interim director of the American Prosecutors Research Institute, as well as the director of National Juvenile Justice Center at the District Attorneys Association. Susan started her career as an assistant district attorney and served as a deputy bureau chief in the Manhattan District Attorney's Office. She has a Juris Doctor degree from St. John's University and an undergraduate degree in political science from SUNY Albany. She's also the chairwoman of the Phoenix, which is a sober, active, nonprofit organization that has served over 26,000 individuals in the United States. Susan is on the advisory board of the Recovery Research Institute at Harvard University. She is on the Faces and Voices of Recovery Criminal Justice and Recovery Policy Committee, also on the advisory board of Facing Addiction. She's a woman in long-term recovery and works with the criminal justice systems to improve responses to addiction through the adoption of innovative prevention, early intervention, treatment, and recovery support programs. So we're very pleased to have Susan available and joining us today to present information about this innovative partnership created in Denver, Colorado. And I will now turn it over to Susan.
Thank you, Patty. Thank you so much. And good afternoon, everyone. As Patty mentioned, my name is Susan Broderick, and I am a woman in long-term recovery. And for me, that means I have not had a drink since July 15th, 2001. And I'm really so excited to be doing this today. As Patty mentioned, I'm now the founder and CEO of Building Bridges to Recovery. And just to give you a little bit of background on that, I really am, at my heart, a criminal justice person. I was a prosecutor. I've worked with prosecutors my entire career. And last year, I was finishing up a grant at Georgetown, and I made the decision to devote this next chapter of my life to working to bring more attention to addiction and recovery to the justice system. So, hello. Hello. So Patty, I guess we can go to the next slide.
Okay. Got it. I'm sorry. There you go.
Hello? Am I on? Okay.
Yes, so you're fine. Go ahead.
Okay. So in putting this presentation together, I was working with the Denver Probation Department and with some of the people at Phoenix, and it became clear that there is a lot to cover here. So what we've decided, and I've spoken to Patty about it, is that this is actually going to be a two-part presentation. Today, I'm going to give you an overview of some of the innovative current research around the role of recovery support within the justice systems. I'm going to highlight the work of Professor David Best from the UK that has been really instrumental in moving the needle in terms of improving responses within the justice system. And then also give you the overview of the organization, the Phoenix, which I am on the board of, and also the program that they are doing with Denver Probation. Next month, we will be coming back with probation officer Scott Prendergast from Denver Probation, who he actually put this program into place. So we will be coming back to answer, to present on sort of the ins and outs, the challenges, and what it took to actually make it happen. So let's just start for today. Patty, next slide, please. You know, we really are at a very unique moment in time right now, and I know that the addiction crisis is definitely and
Yeah, you know what? You feel that.
okay. Next slide, please. However, despite all that we're hearing about, this addiction crisis, I really do believe that we are at quite a turning point for the country. In fact, I was on a call this morning with somebody from NIDA, and we were talking about just all the different opportunities that are coming up right now. And I think in terms of the silver linings of this addiction epidemic, that we're finally paying attention to addiction and recovery, which for years we didn't. And there has been an incredible amount of research over the last 20 years that has led to a much greater understanding of addiction. And the other thing is that, for all the talk about addiction, focusing on the problem, we need to be talking more about the solution and about just the reality of recovery, and that the prognosis for substance use disorders is actually quite good. The majority of people who seek help do eventually achieve sobriety, maybe not immediately, but eventually. And the other really important point, and I think especially right now, is where we are in terms of criminal justice reform. It's happening at the federal level, it's happening at the state level, and it really is one of those few issues that everybody can agree on. So next slide, please. So this is the Manhattan DA's office, and I just have to tell everybody that in preparing for this presentation, I sort of did a timeline, and it's actually pretty amazing when I look back and see how things have unfolded. I started my career in 1989. I was a work hard, play hard prosecutor, and I thought I did both very well. And it was during those years that, I dealt with everything: sex crimes, domestic violence, homicide cases. It was actually after a homicide case that Mr. Morgenthau brought me into his office and congratulated me and put me in charge of child abuse. And I was like, oh, that's a promotion? But it really was an incredible position. And it was actually during my years as a deputy bureau chief in the Manhattan DA's office that I made the decision to address my drinking problem. And I was very lucky. I did not go to treatment. I ended up going to a 12-step meeting on July 15th, 2001, and I have not had a drink since then. And to me, that was always very, very miraculous. And so I continued in the DA's office for 2 more years. And then in 2003, I had always had a childhood dream of living in DC. So I think there's some, okay. I came down to DC in 2003, I worked at the National DA's Association. Somebody on mute, it's hard to. Okay, so I moved down to DC, and then in 2008, next slide, I had the opportunity to go over to Georgetown University. And we're on that slide, right, Patty? Because we're on the Georgetown slide. So in 2008, I started working at Georgetown, and I was primarily looking at juvenile justice issues. But in 2010, I went to the JMATE conference in Baltimore. And it was at that conference that I met John Kelly, who I think many of you have at least heard of if you haven't worked with him directly. And I can honestly say that meeting John Kelly in 2010 was a turning point in my life. And next slide, please, on the criminal justice involvement. So it was at that meeting, or at that conference, when I went to John's presentation, and he was talking all about the criminal justice system being a motivating force for changing behavior. And it just resonated with me, and I knew that this was work that I wanted to get involved with. Next slide, please. So I started looking into John's work. We started working together actually and presenting at conferences together. And I also knew from my many years as a prosecutor, I saw the changes that would happen to people. There was a huge correlation in the cases that I had with, crimes and people having drug and alcohol issues. And I also saw people turning their lives around because of their involvement in the system. And I also knew that from just friends in the program. So many people had told me that the arrest, their court referral was their bottom. So I knew that this was an important message. And, I also knew on a personal level, now while my bottom did not involve an arrest or a referral to the justice system, it was definitely a result of a consequence, and it was a negative thing. And I've never met anybody in recovery who made the decision to get sober because things were going great. It's always a consequence. And for so many people in our country and even internationally, very often it is an arrest or a referral to the justice system. Next slide, please. So with the Recovery Research Institute, if any of you have not heard of this, I cannot recommend it enough. It is amazing. This is John Kelly's program up at Harvard Mass General, and I'm very honored to be on his advisory group. And one day, John and I we were on a call about something, and I mentioned to John that my recovery I really thought was a miracle. And he kind of chuckled and then said, well, you also had very high recovery capital. And I was like, what the heck is recovery capital? I didn't even know what the term meant. So next slide, please. So of course I started looking to see what this recovery capital that he was talking about was. And the concept actually came about back in 2008. Granfield and Cloud had done a study and actually looked at people who had gotten sober through, without treatment. They called it natural recovery. And they said that those people had a depth of internal and external resources that could be drawn upon to initiate and sustain recovery. And Bill White, who I'm sure many of you know, has also written a lot about recovery and talked about the fact that recovery is best predicted on the basis of assets and not pathologies. And that, again, this was, again, something that really resonated with me, because I knew in looking at my own recovery story that I was really lucky and that I did have a good education. I had a pretty resilient personality. So individually, I had those factors that were supportive. And basically, recovery capital is three different things. It's your individual factors, your individual assets and strengths, and then it's also your social assets and strengths. And, there I was also very fortunate. I had a very supportive family, very supportive friends and colleagues. And then finally, the community aspect of Recovery Capital. And I was also very lucky in the fact that I was in New York City where there were meetings all the time, and I had a lot of access to some great recovery. So I really did have high recovery capital, and everything that John said made sense. And next slide, please. So, and the other thing that I came across, oh, this slide isn't, well, I apologize for that it's not aligned here. But anyway, so in terms of recovery capital, the more I looked into it, the more I realized like this is a concept that needs to come into the justice system, because for all the focus on risks and the negative things, we didn't really do a good job in the justice system of looking at strengths and assets. And I just know that for my own recovery story, it was hope. It was going to that meeting and hearing people who had, drank the way I drank, and they were on the other side of it, and they were actually doing really well. And so I just knew that this was something that I wanted to bring to the justice system. So next slide, please. So this is a lovely picture of Boulder, Colorado. And again, this was, I had no idea at the time, but this was another life-changing moment. So in April of 2013, I was meeting with a group of prosecutors from across Colorado. We had a meeting in the Boulder DA's office, and I will never even forget where I was sitting the moment one of the prosecutors was talking about a program that they were using in their drug courts and with probation. And it was called Phoenix. Well, at the time, it was actually called Phoenix Multisport. And she explained that they were using this program, as a condition. And basically what the Phoenix is, it's a sober, active community. The only requirement for membership is 48 hours clean and sober. And I just knew, and they do a lot of fun, athletic, healthy things. And I'm telling you, the minute I heard about this organization, I actually texted 2 friends in New York, and I was like, we need to bring this all over the country. And then lo and behold, the following year, I was able to meet Scott Strode, who is the founder, and Jackie Hilios, who is now the executive vice president or deputy director. And we met in DC, and I was asked to be on the board. And I can honestly tell you that this being involved and being part of the Phoenix family has been one of the most incredible opportunities of my life. And I think, next slide, please. So this is, what I love about the Phoenix is that it's really putting the message on just how amazing recovery can be. You'll see on this is actually one of our members, Chris Daggett. And the thing is, most of the Phoenix members have some type of, or a majority of them have a criminal justice involvement in their past. Chris actually has a criminal justice history from up in Massachusetts, and now he is, one of our leaders. And it's really just an amazing program. And I think, Patty, we have the next, can we do the video now? Is this gonna work? Can you do it, or Patty?
Big difference between Enterprise Infrastructure Solutions Vehicle and Networks, its predecessor, is it's really moving from buying widgets and point solution.
That's not me.
In our series, More Perfect Union, we aim to show
I can't hear it.
system. Everyone there is a recovering addict. There are no initiation fees to join, no monthly dues. The only requirements are 48 hours of sobriety and a will to get your life back. Here at the Phoenix, a sober gym, building muscle is secondary to rebuilding lives.
At first, I didn't think I fit in, but all of my coaches, everybody here welcomed me with open arms.
Dresden has been sober for almost a year now, thanks in part to the support she got at the Phoenix.
They were here when I needed a hug. You know, they encouraged me all the way through my sobriety.
Arrow says his fellow gym members are helping him get through his newly found sobriety.
You just came up on 6 weeks? He did it, and I know I can do it.
Do you wonder where you'd be if you hadn't found the Phoenix?
You know what? I know exactly where I would be.
Where?
And right on the street with the same people, with the same misery.
That's exactly why Scott Strode, a former addict himself, founded the Phoenix.
How many years clean and sober?
A little over 21 years.
Strode discovered fitness was key to achieving, then maintaining his sobriety.
Getting in the gym just kind of gave me this new group of people that supported me. There were some other sober guys in there that boxed, and getting in the ring for the first time kind of started to transform my self-esteem and self-confidence. And
did you know it at the time?
I didn't know it at the time. I just started feeling better about myself for the first time ever.
It feels like you got a new community.
Absolutely. You know, I mean, the activities was a positive coping mechanism, but really the magic was in that community. I'm grateful for this tribe.
So much so, it was the foundation of his first Phoenix gym 12 years ago in Denver.
We always say the hardest part about coming to Phoenix is opening the front door, but we've removed all those other barriers to access because it's free. It doesn't matter sort of what insurance you have or how much money is in the bank account or what your addiction story is.
3, 2, 1, go.
With gyms in 14 cities across 10 states, Strode estimates the nonprofit has helped over 26,000 people with recovery.
I mean, when you look at the addiction crisis sort of facing the country now, there's very few messages of hope out there, and Phoenix is trying to be that flag of hope.
Dana Smith found the Phoenix while she was in prison, convicted of a fatal DUI. She committed herself to a new lifestyle.
3, 2, 1, oh.
That's when she saw Scott Strode on TV.
Beautiful.
Why did that moment speak to you?
It was like every time that I had attempted sobriety in the past, there was something missing. Phoenix felt like it embodied what I needed. It was one of those moments for me where I knew I had to be a part of it.
4 years later, after completing her sentence and probation in Illinois, Dana followed her instinct, moving to Denver to join the Phoenix.
And I'll never forget my first day working out here. I was in tears. The instructors were in tears. We had to tell people that we don't usually cry during our workouts.
The Phoenix community provided support and a career for Dana, who's currently a director with the program.
So you're really kind of pulling with your back?
A new mom, she's been sober for more than 9 years, and now she's trying to inspire others.
You took a life that doesn't go away. How do you live with that?
That's another reason why it was so important to me to come to Phoenix.
I'm Dana. I'm grateful that my daughter will be raised with this Phoenix family.
I knew that I needed to be in a place where I felt comfortable talking about it, and I felt, open and able to share.
I know you can't take back a life. You can't change things. What can you do?
I can help others, and I have to listen the way that people listened for me and the way that people helped me to heal.
People like Scott Strode.
You were one person who wanted to get clean and sober, to have an impact on the numbers that you have. What does that mean to you?
For me, getting out of my addiction was like getting out of a burning building.
Right, thank you.
And I just don't feel like I can walk away if I know people are still in there.
No pressure.
A lot of people glad he didn't walk away. Yeah. Funding for the Phoenix comes from a combination of donations and from grants. And it's really incredible when you're there in the gym and you can feel that spirit. They talk about rising from the ashes. That's the Phoenix. That's what you see in these people.
It comes across in that piece too. Wow.
Yeah, it must make you feel really good when you know that you've done something so horrible, to figure out a way, how can I redeem myself, now help others.
Yeah,
so we're pulling for Dana.
Yeah, and she said very clearly that she can't take back that life. She knows for that family it will never change, and she's not trying to say
Okay, I think that's the end of it. Okay, and so Dana Smith is actually one of the instrumental people in the probation program that's going on in Denver. And I have to tell you, when I first met Dana, she is one of the most amazing people, and her story, they referenced it there in the interview, but Dana had actually, she grew up in Illinois and had become addicted at around the age of 17. And as I mentioned, she got involved, she caused a fatal car collision, and she went to prison for that. And it was in prison that she knew she had to turn her life around. And during that time, she was trained, she hoped to train for the Chicago Marathon. And one night, while they were watching TV, the CNN Hero show came on, and they had, Scott had won the CNN Hero that year award, one of the awards. And Dana said she just watched that program and knew when she was sitting there that this was the organization she wanted to work with when she came out. And as she prepared to leave prison, some of her friends there joked with her and said, well, you know, good luck training for the Chicago Marathon because you're going to be wearing an ankle monitor because you're going to be on parole. And she came out, she was assigned to a parole officer, and it turns out the parole officer had run the Chicago Marathon the year before. And he helped to train her, and she did run the marathon, and she successfully completed parole. And when she did that, she reached out to the Phoenix, and Dana started at the Phoenix as a volunteer, and she is now the director of programming. And to talk about, you know, and it's that whole idea of rising from the ashes and giving people hope and letting people know that recovery is just transformative. And Dana and all of the Phoenix members are just real life examples of that. And so next slide, please. Okay, so love, hope, and random drug testing. This was actually a paper I wrote, and I presented on it at the National Drug Court Conference back in 2017. And this, I wrote this paper because I felt that in some ways we were trying to use addiction as a get out of jail free card. And I knew from my own experience and from seeing things as a prosecutor that, so alcohol and drug use can lead to criminal offending. And so we have to make sure that we, hold people accountable, but then also that we use the leverage of the justice system to turn lives around in a positive way. And having seen what was being done at Phoenix, I knew this could be done. So as I was doing the research for this project, I kept coming across the work of a researcher from the UK. And his name is David Best. And he is a criminologist who looks at the parallels between recovery from addiction and desistance from offending. And when I came across his work, it was just one of those moments where it was life-changing, honestly. And it turned out that David and I are both on John Kelly's advisory council. So I reached out to John Kelly and I said, could you please introduce me to David? And John paused and said, why didn't I think of this before? You and David need to work together. So David and I, next slide, please. We started talking. His work was all about the role that the justice system can play as a turning point. And he was it's in this, it's really an emerging field called positive criminology. And it's all about the fact that the justice system and actually any type of adversity can serve as a turning point. And David and I wrote a book chapter, which I can share. And actually, I talked about the work of the Phoenix in it. And it was interesting. So when I had my first phone call with David, he had already heard about the Phoenix. And he had told me that he has a boxing gym over in the UK that he's waiting. He wants to bring Phoenix over to the UK. But anyway, so one of the things that I really, the most important message that I'd like to share with all of you today is that there is a lot of great research out there about just how transformative recovery can be and just how resilient people are. And next slide, please. So, and this was one of the findings, and it made so much sense, and I think it'll make sense to all of you, is that recovery from addiction as well as desistance from offending both involve changing inside and out. And it was funny because when Scott was first coming up with the idea for criminal justice programming, the name of the Phoenix Criminal Justice Programming is Inside and Out. Because in recognition of, well, first of all, there's opportunities across the entire justice system where we can work to address the addiction issue and turn lives around. So whether it's at the point of arrest, diversion, drug court, probation, or even working on the inside of prisons and helping people on the reentry component, there are so many opportunities inside and out of the system, but then also recognizing that the change for both recovery and desistance involves changing inside and changing the way you think, changing the way you act. And it also involves change on the outside. And that is very often your peer network, the types of activities you're involved in, the community events you go to. So, and next slide, please. So as I mentioned, David's work is part of this field of positive criminology and talks about post-traumatic growth and the fact that adversity provides an opportunity for growth and change. One of the studies that David did was the Glasgow study, where he looked at a number of offenders, which on paper, you know, they had serious criminal justice histories and serious substance use disorders. And what he found in that study is, you know, people underestimate those people. And there is actually so much resilience, and that's what he found in that study, that very often the adversity just generates strength, and that people who have been through a lot have a lot of strength. And so, and that again, very much resonated with me. And I've seen that not only in my work as a prosecutor, but also in the field of recovery and just people that I see at meetings all the time and turning their lives around. And next slide, please. This is probably one of my favorite findings from David Best's work. And he talked about that with most other disorders or diseases, the goal is to get back to well. When you go to a doctor, you want to get well. But what he found when he studied people in long-term recovery is that, in fact, you transcend to a state that can be characterized as better than well. And you really, truly transcend and become the person you're supposed to be. You know, and again, this made sense to me reading it, but the reason that it really impacted me is because I had experienced it. They always talk about life beyond your wildest dreams, and I knew that with the work I'm doing now and working on recovery and justice issues, this is exactly what I'm supposed to be doing, and none of this would have happened if I hadn't gotten sober. So I think David's work is very powerful on a professional level, and then for those of us in recovery who have experienced this, it really is, it's remarkable. Next slide, please. So the second chance study, so I will admit here that I used a football slide from the United States, and his study was about football over in the UK, so it was really a soccer game, but I couldn't find a soccer picture. But anyway, in this study, David looked at using sports as a diversion type of program. And next slide, please. So, and of course, this reminded me of Phoenix. And when you look at the findings here, this is very much similar to what's happening with Phoenix and the different criminal justice programming that they have underway. So what they found is there's a development of a positive sense of identity, moving from addict to athlete. And Scott talked very much, he still talks about that all the time. The perceived improvements in physical health and well-being, developing positive social networks, and identifying role models. And of course, a sense of hope and positive vision about the future. Next slide, please. And I think what you will find, and I really hope that everybody kind of takes a look at the work of David and the other researchers that he's worked with, because I think what you're going to find is there's a lot of optimism in this. And here is one of the quotes that from a study he did with Alexandra Laudette about that recovery is contagious, and it's a powerful force not only in transforming the lives of the individuals blighted by addiction, but in impacting their families and communities as well. And I know that any of us in recovery can attest to that as well. So when I was working on the Love, Hope, and Random Drug Testing, I also came across the work of a Dr. Jim McKay from the University of Pennsylvania, and he talked about one of the reasons that some of the treatment programs and rehabs, they're not getting great outcomes because a lot of them just work on taking out the drugs and the alcohol, but they don't replace them with rewarding and enjoyable activities. And then we wonder why people go back and relapse. And again, this really is supportive of the work that the Phoenix does, because people need to be able to enjoy their life, because if they're not going to enjoy their life, they're probably going to go back to the drugs and the alcohol. So by connecting people to activities they enjoy, people they enjoy being around, you're really increasing the odds of recovery as well. And then for those in the justice system, you're also reducing the odds of reoffending. So it's a win-win. So now we are back in Colorado, and it was about 2 years ago that they realized their drug court, the numbers were just off the charts, and their filings were up about 25 to 30%. A lot of those cases involved assaults and property crimes. And so the probation officers went to the chief of probation, and his name is Carrie Heck, and they just said, we've got to figure something out. We have to find another way to work on these cases. So Carrie Heck spoke with Scott Prendergast, and Scott said, you know what, I have an idea here. And so Scott sat down and he looked at the people that he was working with. It was a group of very high risk, high need offenders. And he said, you know what if we did this a little differently here? What if we came together? He sat down and picked out the groups that he knew he wanted to work with. And so that included the Mile High Behavioral Health System, the Denver Health MAT program, and the Phoenix. And he realized that by bringing the people who could best help those who are on probation, bringing them together and having more of a sense of community, they could get better outcomes. And what they started doing as well was meeting at either the treatment center or Phoenix. And when I heard this, I was just like, this is so brilliant. And, you know, it makes so much sense, and it's really not that complicated. And so what they would do is a number of the probation officers would actually meet their probationers on Monday mornings at Phoenix, where the probationers would check in. They would have their, regular check-in that they would normally have down at the probation office, but then they'd work out together. And this program has just been amazing. When I was speaking to Carrie Heck about it, as I said, he's the director of probation. He just said that the program has transformed the relationships between the probationers and those on probation. And where in the past it used to be that, the probation officer is out to violate me or get a dirty urine, what they find now is that the probation officers are now much more like mentors, and really pulling for them and trying to find ways to help these people turn their lives around. And to me, that is just really the epitome of what happens at Phoenix on a daily basis. Next slide, please. So here, this is Dana again. So the program is specifically designed for the high-risk, high-need offenders in Denver. As I mentioned, it provides wraparound services through a partnership between Denver Adult Probation, Mile High Behavioral Health Care, Denver Health, and the Phoenix. And it really is an amazing program. And the great thing, so now today's conversation, I'm talking about Denver. Phoenix is over the last probably 2 years, Phoenix has been expanding all over the country. Denver, the Champa studio is one of our anchor chapters. We also have another anchor chapter up in Massachusetts, in Boston. And in Massachusetts, we're also doing some innovative criminal justice work there with the sheriff's office. The Middlesex County Sheriff in Massachusetts heard about Phoenix, loved it so much, he found office space and had it transformed into a gym. And they have turned it into a community center where, again, probation, people who are on probation can check in there with their probation officers. And it's also a recreational facility for both those who are on probation and employees of the Middlesex Sheriff's Office. So what I'm hoping to do for the next presentation, part 2 at the end of March, is to, again, get real life examples of these actual programs in both Colorado and in Massachusetts. Next slide, please. Oh, so this is Dana. And I put this in before I realized we were doing the video. So, but she really is just an amazing person. And you talk about being able to carry the message of hope to people on the inside. You know, and what's really funny, well, it's not funny, but it just shows you where we are in terms of improving things in the justice system. Dana is probably can carry one of the most powerful messages to those inside the prisons. And recently, we had an opportunity to go inside one of the prisons, and because of her criminal conviction, she wasn't able to get in. And so again, it's realizing that, you know, that need for second chances, people can and do turn their lives around on a daily basis. And I really think this is the message we need to be sharing with our criminal justice colleagues and allies across the field. So I'm going to try to wrap up so we can have some time for questions. Next slide, please, to final thoughts. I'd just like to really impress upon everybody that the justice system plays a pivotal role in this. And, you know, I go to a lot of conferences where I hear a lot of anger towards the justice system, which I understand because there's certainly cases where the justice system has not acted appropriately. But I also think the reality is that as we're looking at this crisis right now, your justice colleagues in your communities are some of your strongest allies in this work. Every week I'm talking with prosecutors, probation officers, police officers. They can and want to do the right thing. So it's really important that we come together and recognize that the justice system can actually be a turning point in a really good way. We know that initiation to sobriety often happens because of a arrest or a referral, but we also want to make sure that we're going to sustain that change. And I think by partnering with programs such as Phoenix or other activities within your community that will give people that positive activity that brings some joy to their life. We also know that changing social networks and activities are keys to both recovery and assistance, and that positive and negative influence are critical to both. So providing a sense of hope is one of the most important things we can do. I know that not just on a professional level, but on a personal level, and I think we can do that. In terms of, next slide, key advocacy messages, I really would encourage all of you to strengthen your relationships with local law enforcement colleagues. I know that there's a lot of grants coming out right now, and it's amazing to see that the language of peer recovery support has been written into those grants, because I think finally people are recognizing just how critical we are, that the peers in recovery are, that's how people turn their lives around. I would also recommend to work within your communities, because we know that the federal government can play a role in this, and they can hopefully support through funding opportunities, but recovery, and reducing recidivism takes place at the community level. So work within your communities, identify those different resources that could be used to, have some activities. I even went to the gym here, I live in Alexandria, Virginia, and I went down to my sport and health club and I said, you don't really use the gym, the classroom part on Saturday afternoons. What if I brought in a group of sober people? And they were open to that. So again, I think it's more about identifying those assets and those possibilities in our communities. Next slide. The other thing I would also suggest is reach out to wardens and sheriffs and discuss how you can bring some peer recovery support inside the walls of the prisons and the jails, because we recognize that by establishing those relationships while people are on the inside, it makes it so much easier when they're coming out to already have an identified group of peers and activities that they can go to. Finally, I really think that it's time that we include in all of our messaging just how incredible recovery is. It is so often not the part of conversations, and it truly has such a role in turning lives around in a positive way, and also having very important consequences and implications in the justice system. So I think I've included, next slide, I have my email address on there, and I guess we'll open it up to questions now, Patty.
Thank you so much, Susan. That was fantastic. It was a lot of great information, and you're just a wealth of information and expertise in this area. I also want to congratulate you and the Phoenix for your success and the incredible recognition of all the folks involved there, and Scott Strode and Jackie and others. But we'll take a few minutes for questions. I do see I have one question waiting, and feel free, others, if you wanted to type something in. We'll get to your questions for the next few minutes. So this one, Susan, is what are your thoughts on using probationers in sustained recovery that have achieved and sustained sobriety as peer mentors, recovery coaches for others just coming into the drug courts?
I think it's great. Well, and I don't know, again, and you're going to have to check with the state and local rules. So if somebody is currently on probation, is that the question? I don't know if they would be able to do that while they're still on probation, but I think once they've successfully completed probation, I don't think there's any better advocate than somebody who has been through what that person is going through. So I think that there's tremendous potential for people who have been through the justice system, whether through probation, whatever the story is, through drug court, to serve as mentors, to serve as recovery coaches. They can give that real life hope to people. So I would definitely support that and encourage that.
Thanks a lot, Susan. I think it's important also to integrate peer mentors or recovery coaches that have been trained or certified from the whatever entity there is in the state that have that, they're also supported by other peer recovery coaches or peer mentors through a recovery community organization, and they have their own peer support as well when they work in groups.
Absolutely.
Another question is, are you connected with the National Association of Drug Court Professionals, and do you speak at their conferences?
Yes and yes. So yeah, it was actually when I was preparing, I presented Love, Hope, and Random Drug Testing at the 2017 conference. I also, the other thing that I do is I speak at prosecutors' conferences, and I talk about wellness within the professional community. Because that's, with all the talk about criminal justice reform, I think we have to also recognize that addiction is an equal opportunity destroyer, and it doesn't care where you sit in the courtroom. So whether it's the judge, the prosecutor, the defendant, the witness, the victim, it goes across the board. And actually, I had 5 days of sobriety in New York, and I went to a meeting, and they introduced the speaker, and he had started his road to recovery in the Brooklyn House of Detention. And I remember sitting there at first and I was like, oh my God, this is a little embarrassing. And his story spoke to my soul. And I remember going up to him afterwards. I was crying and I said, you're a defendant, I'm a prosecutor, but we're the same. And it really is. And so I think that wherever somebody is in the system, there's opportunities for recovery.
That's great. We have another question about, the question is, do you think going to YMCA 24 hours is a good way to start?
I think that reaching out to YMCAs in your community is a great way to start. And again, it's, one of the things you can do is really like a community mapping exercise and identify different groups like the YMCA, and then go and meet them there, see if there is any time frame where they could devote, even if it's just an hour a week, that could be designated for people with 48 hours clean and sober.
That's great. Thank you. We have just a comment from Idaho. Let me see. In Boise, grateful to have a chapter of Phoenix here in Boise. We partner with them on all kinds of things. Getting corrections on board and with what's working has been trickier.
Right. And you know what happened in Boise? Actually, they went in and I believe they met with the warden and also it was a women's prison, and met with the women. And I guess they were still trying to work out the paperwork. But the amazing thing is that the women, from just having that meeting with the Phoenix members on the inside, were going to Phoenix when they were being released. So it's that idea of just having those opportunities for people. And I think that, there's so many possibilities right now. And that's why I don't know, I could go on for hours today on all the things we could do. So I really want to help any of you that are trying to get this going, because it really is an amazing way to turn lives around.
Thank you. So we had another question about, do you travel? Do you travel to conferences and or do you travel to individual courts to make presentations?
I do.
And, okay, so your email address is here, and that person can contact you directly.
Yes, I'm actually going to Nashville on Monday for 3 days to go and do work with their juvenile drug courts.
Great. Okay, another question is, how would you recommend relaying this information that peer support is crucial to one's recovery? I administer a program that connects those on probation or parole with a provider that offers them care coordination and peer support, and some of the providers don't understand the value, and also some probation officers don't. We have information, data, etc., but is there anything else or a great approach that you would use?
Well, you know what? I think the concept of peer support is based on that whole idea of identification, peer-to-peer identification. So what I would suggest is when you're working with somebody in the justice system, that and that's one of the reasons that I'm doing the work that I'm doing, because I know that a lot of prosecutors, they'll listen to a fellow prosecutor, or they'll listen to somebody who's been in the justice system. They'll listen to another probation officer. So I can help you try to connect with those people that are actually doing this work, because I think to convince a probation officer that this is something that could and would work, it would be really helpful for them to hear it like from somebody from Denver probation who can tell them, yeah, this is what we're doing and it's working. You know what I mean?
Yeah, that makes a lot of sense. Thank you. Another question is, to the best of your knowledge, are there any Phoenix chapters in or near Minneapolis, St. Paul?
Yes, I know one of our director of programming, Nell Hurley, is, I'm trying to remember exactly where it is. The thing is, we're growing by leaps and bounds. So, but if that person wants to email me, I will get all that information and I can send it to you.
Okay, that sounds great.
I would also go to the Phoenix's website, www.thephoenix.org. It's just amazing, amazing, amazing. And also the work of David Best is absolutely amazing. I feel like, I've been lucky enough to come across some of the most amazing organizations and people, and it's all because of my recovery.
Right. Are there any Minnesota courts that are participating that you know of?
Not that I know of right now, but again, I've worked with a number of the prosecutors in Minnesota, so I would be more than happy to speak with them. And, and I think what's happening now too is that given even the grants that are coming out and the recognition of recovery support, there's still so many in the criminal justice system that have no idea what that means. Mm-hmm. So I think this is where the recovery advocates should really be, setting up those meetings, having these conversations, letting their criminal justice colleagues know this is what recovery support is and this is what it can do. You can cite some of the work of David Best. You can check out, and again, I really think that John Kelly's website is amazing. Every day he has new research up there, and I really feel like the tide is turning and we're focusing more on the solution, because and that's one of the things as a former prosecutor, and I remember saying that to a judge that I was a former prosecutor, and he said there's no such thing. But I do know that, my role was always to be a problem solver and to find the solutions. And I feel that, recovery, we need to be doing as much as we can to promote the solution of recovery.
Right. I'm just going to quickly go through a few of the other comments and maybe get to one more question before we wrap up. But wanted to mention that there's some great work going on in Houston. Nolan says that they're recently incorporating CrossFit recovery into their program at the Center for Recovery and Wellness.
Perfect.
And then that they're doing a workout every day and Sunday, looking to start a sports program through the Yes Initiative. And he's asking what would be a good route to start a sports program for the children whose parents have been addicted to substance use disorder or addicted.
Yes.
What do you think about that, Susan?
No, I think that's great. And I know that Phoenix did that a couple of years ago, and it was, I believe, through a SAMHSA grant. But I can find out more, and if that person wants to email me, I will get some more details about that. But absolutely. And again, this is another one of the silver linings of this crisis, that we're finally looking at the impact on children. I was just at a conference for the National Drug Endangered Children's Alliance, and that, the child welfare system right now is getting overwhelmed, and we need to be doing more to help these children, because you talk about being at risk for substance use disorder. These kids really need help. So definitely reach out to me and I'll get more information about what we were doing in Phoenix with that.
That's fantastic. Well, I just want to thank you, Susan, and thank you, everybody, for participating. I do want you to know that the slides, as well as this recording, will be available on our website. And if you have we'll post it under the National Recovery Institute, which is our training division. And so we'll be sending out a link to this webinar, as well as the slide deck. So if you are interested in emailing Susan Broderick, her email address is on the slide. It's Susan at bb2recovery, bb2recovery.com, which is Building Bridges to Recovery. And you can actually just find out more about Susan on her website, which is www.bb2recovery.com. I also want to make sure that we tie this up with a little bit of why we do this work here at Faces and Voices of Recovery. And Susan touched on a few advocacy points. I think it's really important that we engage you as the interested, mobilizing the recovery community, people who work in the field, care about recovery, our family, friends, and allies across the nation, to join together to be a little bit, to learn more and be more vocal, to make these things happen, to make sure that there's programs that meet all interest levels and all recovery lifestyles across the nation. So this is just one example of how you all that participated today can take this information and start, and advocate for programs like what Susan has talked about that increase our recovery capital and really build those recovery communities for the long, to be a stronger infrastructure across the nation. So advocates and you all make a world of difference for the work that we do at Faces and Voices. So thank you all for participating today. If you have any questions, want to contact Susan, it's susan@bb2recovery.com. And if you'd like to contact me for more information or want to check in on when the webinar will be on the website, just send me an email at pmccarthy@facesandvoicesofrecovery.org. Thank you all and have a great day.
Bye-bye.
Bye.